Let's start with that big doctor's appointment, the appointment, where you get the diagnosis. You have a fatty liver. You may have multiple chronic conditions. And so it's been recommended to you that you begin resistance training. Well, what does that mean? Is that the barbell in your basement? Is that hand weights? Is it a loop, a band, a tube? Can I use my own body? That's a form of resistance. When we start throwing all those options out there, things become very overwhelming. And for a lot of us, we're going to check out on that. So that's one of the things we want to talk about tonight. Next slide, please. So my objectives today, among that one, we're also going to bring to light the common barriers toward exercise. And you need to know there is no shame in relating to these barriers, because part of this challenge is not your responsibility as a patient or client. It's ours as exercise providers to help you get through that challenge. So we'll talk about the recommendations for resistance training, what works, how much, how often, and we'll also dig into the resistance training program, part of that cornerstone of care that Dr. Zapaka just mentioned. We've been doing a program with Dr. Zapaka since late 2017, so we'll talk about that as well. We'll take a look at the evidence which backs resistance training as part of the treatment protocol for many chronic illnesses and conditions. And we'll also give you a little insight into the approach that we take with people who may be returning to exercise for the first time in a very long time, or maybe exercising regularly for the first time in their adult lives. We have to find the purpose and the reason for them to create this habit. And then our last point tonight, I'll talk about some desired outcomes. And I will tell you right now, they are not what you may be thinking in this moment. Next slide, please. So we know from exercise behavior studies that to create this habit of consistency, there has to be an alignment of values and a pattern of behavior. We learned this from a study that happened in 2014 with Middle Tennessee State University, and they studied fitness psychology and this connecting the values and the behavior pattern. So we have to link this pattern with happiness and joy and having pleasant feelings. No one wants to do something if they don't enjoy it. We may have to, but we have to find that link and associate those pleasant experiences with movement to create that pattern of consistency. When someone is at a crossroads in their health, that alignment is off. There's a bit of a disconnect. So a patient or a client might say something like this: I value my good health. I want to be healthy, but I'm overweight and I do not have an active lifestyle. So when we hear something like that, or there's that misalignment in values, we have to call out the barriers first. And the big one is time. Insufficient time to exercise. What does that really mean? That means, as according to the Mayo Clinic, who put together, they identified all of these barriers. When someone says, I don't have the time, what they might really be saying is, I have something in that place right now, and I don't want to move it. I have something that I enjoy there, and I don't want it to go away. So now we just say, there is no time. The ripple effect of change is bigger than we realize. It's very easy for me as an exercise provider to say, you just need to exercise 30 minutes a day and you need to do it 2-3 times a week. But now that 30 minutes sounds simple, but what used to happen in that 30 minutes? And where does that activity go? And what other parts of the day are now affected because that 30 minutes has been inserted? And what people in my life are being affected? And compound that with the 30 minutes happening 3 times a week. All of a sudden we become overwhelmed again. So as exercise providers, we have to help. We must prepare our clients for change. That second barrier, you can see the inconvenience of exercise. Do I have to drive to a gym? Where am I going to do this? Do I have to create a space at home? I don't want to go to a new environment. That's the inconvenience of exercise. A lack of self-motivation is really about community and connection with other people who are going through the same experience. Change is always easier with other people on board, especially when starting an exercise routine. Community is key. Non-enjoyment of exercise. This is the person who's had the bad experience at the gym. This is the person who's had the body shaming experience with a trainer. This is someone who still remembers the horrible gym classes in high school, and they haven't exercised since. So again, we need to create experiences that are pleasant, that you have a perceived control of, and that we create those memories so we're more consistent, because we want to create those bank of memories for someone who may not have any memories associated with the joy of movement. And so they might be the people who say, I don't like to exercise. They have a very different bank of memories. So again, this is about change. Probably most important of all the barriers, the one at the bottom, this is the fear of self-efficacy, or this is a low self-efficacy and just fear. And what we're talking about here is the fear of injury, the fear of falling, the fear of embarrassment. We need to remove those barriers as exercise providers. So when we bring forth a program where someone feels they have control, where they can progress at their pace while still staying within the realm of doing something effective, we take away this barrier. So as exercise providers, we are changing the way exercise is presented. We have to follow that researched, prescribed way to move, but we need to approach this in a less clinical style. Next slide, please. So the plan has to be a little less rigid, but structured. We want to focus on progress over perfection and the outdated cliches that you might associate with exercise. No pain, no gain. It's just like brushing your teeth. Make it a habit until you don't think about it. No thought, just action. We need to bridge the gap that I have here on this slide. Bridge that gap between the clinical space of something prescribed, almost like a physical therapy setting, but taking it up in from the other side of that group exercise perceived notion of being judged or what that atmosphere feels like. We want to meet them somewhere in the middle. Next slide, please. So the recommendation and the recommended amount of resistance training is here in the infographic from the American College of Sports Medicine. And it's 2 to 3 sets of 8 to 12 repetitions. And so how heavy do we start? What band do we use? We're going to pick a starting point and a starting amount of resistance based on the recommendations and assessment of a fitness professional. So the total body will include 8 to 10 multi-joint exercises and then working the major muscle groups while we do those 8 to 10 multi-joint exercises. So the workout in its entirety is going to go about 30 to 40 minutes with a small warm-up and a small cool-down, a period of stretching, and they'll do that workout 2 to 3 times a week, which you'll see right there in the infographic. But how do we do it? We need to simplify the equipment all the way down to handled resistance tubing. And so this makes the workout very easy, very accessible. Just a handled resistance tube and body weight is what we're going to use. So you can do this in front of the television, in watching your favorite show. You can do this on vacation. You can take it when you're traveling anywhere, on business. You can do it at work. If you're still in an office, take the band with you. It's in a drawer. So there are no gyms required, making this a very accessible program. Let's look at the evidence-backed benefits for resistance training, also in this infographic right there on the left-hand side. Resistance training improves muscle strength, endurance, and power. What is power? Power is control and self-efficacy over the body's movement. So we take away that fear of falling. We take away the fear of embarrassment. We take away the fear of self-injury once they have that self-efficacy and control through resistance training. Because before we can recommend any vigorous cardio, any type of aerobic activity, we have to make sure that the core stability, the balance, and that self-confidence is there for a client to say, I'm ready to move on and I can do more. Resistance training accomplishes that. There are other benefits too. You can see there on the left. Of course, blood glucose regulation, as Dr. Zapaka mentioned. Bone, muscle, and connective tissue durability and growth improves with consistent resistance training. And there are other benefits as well that you can see there. And as you see, the long list of conditions, which can include resistance training as part of the treatment protocol, and to help manage symptoms within those chronic illnesses. But what about fatty liver? Next slide, please. So this is from 2014, from the World Journal of Gastroenterology. And again, we start with what the report uncovered, the barriers with fatty liver patients. We know that there is a poorer health-related quality of life compared with healthy U.S. population, both on the physical and mental health scores. Fatigue is a common symptom among it. So we also know that although NAFLD patients want that healthy lifestyle, here's that disconnect again. They lack the self-confidence because they are afraid of falling. Next slide, please. So here's the evidence from the same report from the World Journal of Gastroenterology. Number one, with weight management and cardiovascular health, improving balance and reducing the risks of falls, right? Several components of physical function contributes to health-related quality of life and well tolerated even among coronary heart disease or the elderly. So a wide population of people can be helped with resistance training. And the American Heart Association and the ACSM say that if you have physical limitations or you have low motivation, which prevents aerobic training, that patient or that client isn't there yet for cardio, for aerobic activity, start with resistance training as the alternative option, building that self-efficacy, that core stability, and balance. So in our own program, we kind of take that a step further with the option to perform the resistance tube exercises, either standing or seated. Again, making sure that the client understands they have control over their body and they will not self-injure before we progress them. Next slide, please. So this is our approach, and it's part of our Be Well at Home program. We've been working with Dr. Zapaka since 2017, and we start this. We took the American College of Sports Medicine recommendations, and our exercise physiologist Leslie Benedetto designed a series of exercises that we use in the Be Well at Home program. One of the big components is community and ongoing human connection. We start with a live 2-hour interactive in-person or online workshop. And this is where we work on the basics. We work on form, we work on safety. We make sure that when a client leaves that workshop, they have the groundwork for self-efficacy. It's already been set. So in our workshop, when we talk about barriers, we also talk about current lifestyles because again, we want to add this in to a client's life. We don't want them to think that it's an either or. That is a lot of hard change. Let's insert it first instead of thinking about what can be eliminated. So can we fit this in while you're watching television? Can we fit this in while you're listening to music? That's what we talk about. What's your current lifestyle like? Can you work out in the morning or the evening? Where are you your most productive? These are the things that we talk about. We want to maximize enjoyment and minimize the pain of change, giving that perceived choice to our clients so that they feel they are in control and they are setting the tone with this resistance training program. So our goal for our Be Well at Home participants is to shift that mindset from the, I have to exercise, to the, I want to exercise. We follow that up with social support as well. We have everything from social media. They have access to the facilitators of the program, including myself. We have a series of emails that we send out because that connection is important. Next slide, please. So we could break all of these barriers. We could personalize the workout. We could keep the communications line open. But what is really needed, the key ingredient, is for our clients to find a purpose. What is the why, the intrinsic motivation for them to begin this exercise program? And it can't be the number on the scale. It can't be because my doctor told me so, a class reunion, a wedding. Those are short-term goal setting. It's a great marker for motivation, but the American Council on Exercise reports that it takes 6 months of consistent practices before any habit will become part of a lifestyle, and we've got some long-term adherence to an exercise program. So this kind of takes us back to the crossroads in someone's health. Take the road that you're on right now, and your doctors have very well told you what path you will go down if you take that road. But take the other road, and you'll find some true value and purpose that will keep you going. A better quality of life, maybe a reason to improve your health, something that's going to keep you going on the days when you do not want to resistance train. And we are very honest, and we tell clients that they will have those days where they do not want to exercise. And so that's when you have to find that intrinsic motivation that is going to cause you to pick up the band or decide to exercise when you do not want to exercise. Something that I just found this week is April 2021 Harvard study published through the Journal of Behavioral Medicine. They actually found a bidirectional relationship between exercise and a purpose in life. So when you begin physical activity, and in their study it was a course of 4 years, when you begin physical activity, you start to find more purpose and meaning in your life. And once you have more purpose and meaning in your life, you engage in more physical activity. Next slide, please. So one way to uncover that purpose and put together an action plan, for us, we actually have our clients write it out. This is from our updated manual. It's the blueprint for success, and we have them ask and answer these questions for themselves. They don't have to turn this back into us. But in this sample that you have here, we ask our clients to complete this, and this little blueprint sets them up for exercising, but more importantly, again, for those moments when they don't feel like exercising. And completing this form on their own gives them, again, perceived choice. So now I'm not just an exercise authority telling you what to do and why you need to do it. You know why you want to do it. And so in those situations, you are setting the tone and you are in control of this plan for yourself. Next slide, please. And we know that physicians have goals for weight management. We have goals for the amount of time that you will spend doing this workout. Of course, those are the guidelines that we need to have an effective outcome. But there are other desired outcomes from long-term exercise and consistent exercise aside from those initial goals. The first one is self-efficacy. And this is really, I think I've said that a bunch of times already tonight, but after the first 12 weeks of regular exercise, our goal for clients is for them to say, what can I do next? Can I do some aerobic activity? Could I walk a couple of miles a day? Could I pick up a hand weight? Maybe I could go to an exercise class. We want them to have the confidence and the control over their bodies to say, what can I do next to continue their exercise journey? An alignment of values and actions, now in alignment. Before they were out of alignment, now they're in after building that routine of exercise. With recommended consistency, we want to make sure that that shift has happened from not just I want to be healthy, but I am getting healthier and I am living a healthy lifestyle. Improved quality of living. With consistency, we know that the fatigue of the fatty liver patient will improve with regular resistance training. And we want activities of daily living to also improve, not just in quantity, but in quality of daily living. And our last desired outcome, creating joyful experiences, because we know many, many times over when we have joyful memories, pleasant memories associated with movement, we want to do more of them. Again, creating that adherence for lifestyle change.